Well, welcome everyone to the Physicians Committee's Mission Critical Update with Dr. Neal Barnard. Today is October 30th, 2020. I'm Betsy Wason, PCRM's Vice President of Development, and we're so glad that you're joining us. So in today's briefing, we'll hear from Dr. Barnard, and we'll also hear from special guest Mark Kennedy, who will explain to us about a lawsuit that was filed this week that could have monumental implications regarding dairy. And we'll also hear from Emily Anderson, who's here to share the latest on PCRM's virtual Hill Day for Animals happening in November. So, and let me take a moment to just thank you. The word unprecedented might be the most overused word this year, yet it still rings true when we think about all the first-time situations that have been thrown at us in 2020. And thanks to your support, you've helped the Physicians Committee take these challenges and turn them into opportunities to widen and spread and push our mission forward. So your donations have made us stronger. Your voice has made us louder, and together we are getting more things done than we ever have before. So an easy way to continue to support this work is to make a tax-deductible donation on our homepage. That's PCRM.org, and it's easy to get to on your phone, on your tablet, on your laptop, and you'll see the donate button right there at the top of the screen. So every dollar counts, and thanks so much for partnering with us on this very important work. If you haven't already, I see some of you are starting, that's wonderful. Please go ahead and use the chat box to say hello, let us know from where you're joining, and let us know how you're doing. How are you doing today? If you choose all attendees from the drop-down menu, then the messages in the chat will go to everyone and we'll all be able to see each other's chats. So now let me turn it over to our first presenter. Mark Kennedy is PCRM's Vice President of Legal Affairs. He's back on Mission Critical to give us the inside scoop on a lawsuit that was filed this week in the fight against dairy. So Mark, we're glad to have you here today, and we are ready for your update.
Thanks, Betsy. Well, let me start with some statistics, and I'm sure you've heard most of these before, but of course, milk is one of the top sources of saturated fat in the diet, especially for children. And it is also shown not to improve bone health, despite what we've heard for years. Nevertheless, it is a required part of every lunch served under the National School Lunch Program. And this is true even though milk is very much of a problem for children of color. You've probably heard of lactose intolerance. This is the natural ability, or the natural disability, depending how you look at it, to consume the sugar found in milk. And what happens is, if you are a mammal, is that over the course of your childhood, you lose the ability to consume this sugar. And if you continue to consume milk, you will experience pain, discomfort, abdominal pain, the whole run of problems, diarrhea, I mean, things nobody wants. Lactose intolerance is especially common, as I said, in people of color. And let me just give you some statistics, and these are right off the NIH's website. 95% of Asians, 60 to 80% of Blacks, 80 to 100% of American Indians, and 50 to 80% of Latinos experience some version of lactose intolerance. So with that in mind, earlier this year, we worked with a school in Florida. This is a charter school called King Charter Schools in Florida, and it wants to open a fully plant-based school. And this school has an innovative educational mission that involves civic duty and engagement and an emphasis on empathy and sustainable living. So this is very much part of this school's mission. And in working with their school district to open, this came up. How are you going to serve a fully plant-based menu? And the school wrote to the agency in Florida that does the work of the USDA to sort of carry out this program. and said, look, here's our plan. And the plan was very different from what most schools do. And the reason is that accepting that they would have to provide some amount of cow's milk, they devised a system that might make it the best for their students. In particular, because where they're located, 25% of the population is of people of color. So, there's a lot of lactose intolerance going around. So they said to the agency, we'd like to run our program in the following way. And the plan is to put milk, dairy milk, as required at the very end of the lunch line and serve it using cups. And so students, if they wish, could pour themselves the amount of milk that they want, or they can decline it entirely. And declining your milk is an option under the school lunch program. And they also plan to have educational material on the walls, as posters, as brochures around the school, and also as part of the curriculum, telling students, this is what milk and dairy will do to your body. So this is just part of a nutrition component of the curriculum. Sent this information to the state agency, who then wrote back rather quickly, said, no to all of that. On the point of the educational material, the agency said that the school couldn't post any of this material anywhere or share it with the students anywhere on premises. So that would include the entire curriculum, reaching all the way into the classroom. And then as pertains to the milk itself, the agency said, this is a real concern the agency had, that you wouldn't want to serve milk in cups because the students might spill it. And so we've been working with the school to say all of this is wrong. And this has given the school a great opportunity to be the first of its kind to challenge the dairy requirement in the school lunch program. It's a mandatory component, as I said, but there are usually two ways allowed by the program that a student can request something other than dairy milk. They could go visit a doctor, a physician, or a nurse practitioner, somebody who can write prescriptions and actually get a doctor's note that says, I have a disability. And that's the word disability that prevents me from drinking milk because it's going to cause me pain, it's going to cause me discomfort. If they get that note after visiting the doctor, paying for the doctor visit, then yeah, they can tell the school, I have a right to this option. Otherwise, the school can disregard a request. You could go to your parent, you could go to another medical authority and get a note that says, I can't drink milk, either for my personal reasons, because I'm vegan, because it's my religious belief. None of that. The school can disregard it. So we pointed all of this out in the brief. And I say we, which is kind of a collective thing, because in a sense, the lawsuit itself is being filed by the school, and there's a law firm in Florida helping, but we have been feeding them literally, figuratively that is, every little bit of information we have. So this lawsuit says, and it was filed just yesterday, it says that the requirement to serve dairy in the school lunch program causes a disparate impact. That's a form of discrimination that is unlawful under federal law, in that it stigmatizes students of color who wish to have something other than milk because of their biological need, basically, for something other than milk. And it also says that the requirement violates the First Amendment in restricting speech, not only in the cafeteria and in the school lunch line, but all across the premises. I mean, that was the literal statement in the agency's rejection of this plan. Now, one really interesting thing about this rule is that the agency says that providing information about the negative effects of dairy would have the effect of indirectly or directly restricting the marketing of milk. And that is a real rule in the statute. You can't do something that would do that. But the rule was put in place for contracts with beverage companies. It wasn't put in place for educational curriculum. It wasn't put in place for thoughts, the very things covered by the First Amendment. Not only that, USDA has taken this rule in the statute and just driven it as far as it can first to a policy announcement in 2018 that actually restricts where water can be in the cafeteria. So the idea is that you wouldn't want, this is agency thinking, they wouldn't want the students to see the water first, maybe at the water fountain or in a pitcher of water, and lose interest in the milk. And this is a real rule. And it's been cited even by the agency in issuing this opinion. And then not only that, of course, the agency, and others have said, well, if you choose not to participate in the school lunch program, that's up to you. But of course, this is a program that provides significant financial benefits to schools. For every lunch meal served, a school gets back a certain amount of reimbursement. And that's what allows them to sell the meal at a low price to students, and sometimes free, and then get reimbursed for the difference. So any school who wants to meet their bottom line, who doesn't want to go out of business, who wants to be able to support their other programs financially, will participate in the school lunch program. It is simply not feasible for them not to do so. On top of that, the substitution scheme is such that if you are purchasing a substitution as a school for milk, you have to pay everything above and beyond the cost of the milk itself. And of course, milk is subsidized by the federal government. So the entire system is rigged. And we say all of this in a lawsuit. And the idea is that no school should have to serve its students milk. No student should have to make students uncomfortable. And every school should have the right to say honest and truthful things about milk. I mean, that's just common sense. So we have a First Amendment argument in there. We have an anti-discrimination argument in there. And it's a thing of beauty. So we filed this lawsuit yesterday, and it's going to make its way through the courts. There should be a hearing in 2021, which is sooner than it seems. And we will keep you updated as things move along.
Thank you, Mark. That is mind-blowing. And we're so glad that you're on this case and fighting this fight for so many people and for animals. Thank you.
Yeah, thank you.
The chat box is such a fun thing to see when everyone is chatting away. And let me just say hello to Tessa in Ventura. We have Janet from Bermuda and Zita from the Philippines joining us today. Nilly in Dallas, and Incy, we miss you too. Thank you for being here on Mission Critical today. So now let me turn it over to Dr. Barnard.
Thank you, Betsy. Thank you, Mark, and thanks to all of you for joining us, and thanks for everybody for saying hi in the chat box. It's great to see old friends, new friends, and some very far away, but it's good for us to be able to come together. I'd like to share my screen because the pandemic that we kind of wished was gone by now is not only is it not gone, it's in some ways really getting worse. And if you don't mind, I want to just walk you through where we are with it. And if the little photo strip on the right side of your screen is in the way, feel free to minimize that if you'd like, or you can drag it to a different position or something like that. I want to start with just some numbers on where we are with the pandemic. And these are from the University of Washington. And as you can see along the kind of fine print along the bottom shows the dates, and that first peak was in April, but now we're October 30th. And what you're seeing now are the deaths per day. And back in April, we were at the highest point of deaths per day. But as you can see, where we are now is we're heading back up into those numbers. So as we reach November, December, January, the projections are that we're going to be back to where we were pretty well. And now this is the cumulative deaths. It's just the United States. But where we are now is 227,760. Frankly, that's higher than was predicted back when this began, but we're not done. The current projection, if people continue to behave as they are expected to, or as they are now, we're going to have just about 400,000 deaths by February 1st, and continuing up from there. So that's all the bad news, I have to say. With regard to what needs to be done, apart from masks, social distancing, hygiene, and vaccines, all of which are important and all of which are going forward, we need to focus on the underlying health conditions. You've heard me say that before. If you have diabetes, if you have hypertension, if you are overweight, that's what really turns COVID-19 into the most dangerous infection. So when the virus first emerged in China, it was clear that people who had diabetes that was in poor control, they were at much higher risk of dying, 11% mortality in that group. But if people had diabetes in good control, the mortality was cut to just 1%. And the difference in A1C values was not really that dramatic. The point being that it's relatively easy to get under better control, particularly with diet. And many people have pointed out, quite rightly, that there are racial disparities in COVID deaths. And a paper just came out in the New England Journal of Medicine that I want to share with you. It was a report from the Oxnard Health System in Louisiana, and they were reporting deaths between March 1st and April 11th. And they had more than 3,000 COVID cases. Of these, the death rate was about 1 in 10, 326 deaths. And more than 70% of those deaths occurred in Black individuals. So what's the reason for that? Is there something genetic that's going on, or is it something else? Bottom line, it's not genes and has nothing to do with the color of your skin. What it has to do is if you adjust for economic factors, which is what kind of job you have. Are you a person who is able to work from home versus being unable to work from home because of your job? How far are you from a hospital? Is there a good hospital near you? Other economic factors. And if you adjust for the underlying conditions, the prevalence of obesity, the prevalence of diabetes and hypertension, which are more common in Blacks, say, compared to whites. If you adjust for these things, it turned out that mortality in Blacks was 11% less than in whites. So not that that's a statistically important difference. The point being that the reason that Blacks were dying and are dying in higher numbers is because of these two issues, economic issues and underlying health conditions. So Wednesday of this week, here in Washington, D.C., I spoke to the DC City Council. We had a health public oversight hearing on the district's response to COVID. And here in the district, Blacks are 46% of the population, but 75% of deaths. And the district is doing a pretty good job with regard to promoting masks and hygiene and social distancing. And it's doing its best to increase access to medical care. But where the District of Columbia has dropped the ball is the same place that the federal government has dropped the ball. On the White House coronavirus task force, there is not a single expert on diabetes, not a single expert on hypertension, and not a single expert on obesity. There are experts in virology, but not in the underlying health conditions. So you don't hear in the messaging on the nightly news about the need to get these conditions under better control. So that's what I called for. And it's going to continue to be a struggle, but we've been pushing very, very hard on this. And we do have friends in the government who are starting to say we really need to get this information out there far and wide. And then we are now also working with other major organizations, including the American Medical Association, to see what we can do to advocate for getting a better understanding, not only of the need to tackle diabetes and tackle hypertension, but the value of a vegan diet, getting the animals off your plate, and tackling all of this, because that's what it all comes down to. We had, as you know, if you've been on these calls, we've had a very successful Fight COVID with Food series. We had more than 5,000 participants in these classes, which have been geo-targeted into urban areas and particularly economically disadvantaged areas, and the response has been so enthusiastic. I got to tell you, it would make your heart sing. We are planning now for the next series, which will be in early 2021. So we have not stopped all of our other advocacy. Josh Yu, a PhD on our staff, continues in China. He's been in China all year, and he's showing no signs of stopping. He's reaching huge audiences everywhere he goes, all about what? Going vegan, tackling these health challenges, getting the animals off your plate. We're still very active in India and everywhere else, so lots more to come. So Betsy, let me stop my share, and I'm going to send it back to you.
Thank you, Dr. Barnard, for the updates on our continuing work and also for always bringing us some new information on Mission Critical. And it's great to hear that you and PCRM are pushing the government to raise awareness of nutrition issues. Well, let me introduce our next presenter. Emily Anderson is part of PCRM's Research and Regulatory Affairs team. working to end animal experiments. And Emily is coordinating our first virtual Hill Day for animals, and hopefully you all have received an invitation to participate. Emily is going to talk to us more about this event that could prove to be extremely influential. Emily.
Thank you, Betsy, and hello to everyone on the call today. It's so nice to see so many people joining, and I am going to share my screen, so you should be able to see my slides now. Okay, I am happy to be here today to speak with you about this upcoming event that we are very excited for. It's our first virtual Hill Day to rally for non-animal research and testing. It's taking place November 16th to 18th, and there's still time to register. Registration will close November 2nd, which is this Monday. Many of you have already signed up. We already have 130 people registered, which is a really great number. But now we are aiming for 160, so we're hoping that you can help us get there. A Hill Day is sometimes called a lobby day or advocacy day, and it's an event that brings people together from all over the country to Washington, D.C. to speak directly to their members of Congress on issues of importance to them and the organizing group. Hill Days are a powerful way for constituents to advocate for a cause they believe in and for legislators to hear from the people they represent. This is your opportunity to work together with us to help animals and influence your members of Congress. For those of you still a little bit unsure, I'd like to give you a better idea today of what exactly this event will be like. I first just want to emphasize that no experience is necessary to fully participate in this event. Our staff has some really fun and informational training sessions planned for you, and we will provide you with all the information you'll need to know. I know all of us on today's call are aware that animal research and testing is cruel. Animals are forced to live their lives in labs and forced to undergo painful procedures, and it doesn't bring us to the treatments we need to ensure human health. We are working to change that. So for our Hill Day, we will be meeting with Congress to ask them to push the FDA and the NIH to make a commitment to end animal experimentation. The EPA made a similar commitment to this last year, which you may have heard us talk about at previous Mission Criticals. And since then, we've seen this commitment begin redirecting the scientific community. So we'd like to see these other agencies that unfortunately still contribute to a huge amount of animal experimentation also set a similar commitment. And along with this commitment, we will be requesting that within 1 year, the agencies begin developing implementation plans that include all the necessary steps to achieving this goal. I've provided on the slide a brief outline of what our kickoff session will look like. Our kickoff session is Monday, November 16th from 12 to 2 p.m. Eastern Time. And we will be going fully virtual for this event, which of course we wish we could see you all in person, but it's actually great that this can be virtual now because we have this opportunity to involve so many more of our members without having to ask people to travel to DC. And although we are referring to this as a Hill Day, it will actually be spread out over the course of the 3 days so that you won't be on a Zoom call with us all day. So before the event begins, we will group you with other constituents from your area to set virtual meetings with your congressional offices. I know this might sound a little bit intimidating, but again, you don't need any advocacy experience to do this. We will provide you with all the information and training you need. So our kickoff session, we will teach you the advocacy basics and talking points so that you'll be fully prepared for your meetings. You will hear from PCRM's experts, including Dr. Barnard, Christy Sullivan, Elizabeth Baker, and Dr. Ann Lamb. We have also built in time during this session for groups to prepare with each other over Zoom. And because we will be going over all this background information, this session is mandatory for participants to attend. Following this session, you and your group will have the opportunity to meet with your members of Congress or their staff at times scheduled throughout the 3 days to talk to them about why ending animal research and testing matters to you. These meetings are brief, typically only around 15 to 30 minutes, and you will have flexibility in scheduling these, though you do not need to be available for the entirety of the 3 days. On Tuesday and Wednesday, we will also come together for additional training. On Tuesday, we will learn more about social media advocacy, as well as review the issues, more time for Q&A, and more time to practice with your groups if necessary. On Wednesday, we will have our closing session in the afternoon, and we will then cover another really important part of advocacy work, which is following up with all the offices to make sure that the work gets done. To give you a better sense of the time commitment, if you participate fully in the Hill Day, it is expected to be about 4 to 5 hour time commitment throughout the 3 days. And this includes attending these 3 training sessions and participating in several of your legislator meetings. In addition to this, there will be about an hour of prep work leading up to the event. So if you would like to register, please visit this link at pcrm.org/events/virtual Hill Day, and you'll receive this in an email following this call as well. Registration closes this Monday, November 2nd at 12 p.m. So you do have a few more days to register, and we hope that you will join us and help us to influence Congress to prioritize this important issue that will protect animals and humans. Thank you so much, and if there's any further questions, I'll add my email in the chat and feel free to reach out. Thank you.
Thank you so much, Emily. And you know, it seems like quite a time commitment, but when you think about how worthwhile it is going to be, it is not a lot of time at all to make such a huge difference. And we're so fortunate that you and the other PCRM staff will be there holding our hands the entire way, making it easy and letting us know exactly what we need to do to be effective. Now, let me go ahead and turn it back over to Dr. Barnard for closing remarks. Dr. Barnard, there is a question in the chat that might take you 30 seconds to answer, or we might have to push it to a whole nother mission critical. How important is it to go vegan versus vegetarian?
Oh, what a great question. Let me tackle that. And this sort of relates to some of the comments that Mark was making earlier, where he was focusing on milk in a school. And I imagine, I think probably most of the people on this call have a real heart for animals. And they probably don't like the idea of eating meat. And I'm sure many, if not most, maybe everybody, has taken the meat off their plate, so they're not killing animals anymore. But they think, well, what about milk? You don't kill a cow. So why would a person who's concerned about animals be concerned about dairy? What's the advantage of vegan versus vegetarian? Okay. Well, we'd like to imagine that milk just comes from a carton. It actually comes from a cow, and cows don't produce milk normally. Nobody produces milk unless they have given birth. And so this is just kind of biology 101. So this is what I'm coming to, is why it's a useful thing to get the dairy products off your plate. The cows are on every dairy in the United States. They are artificially inseminated every year to get them pregnant. And then when they give birth, as they must in order to produce milk, their calves are taken away from them. If their calves are male, they are killed quite soon, because some people have a taste for the rubbery texture of a newborn calf's muscle tissue. That's called veal. If they are females, they are taken and raised in isolation and given a milk substitute until they're old enough to be artificially inseminated themselves. And then the mother who's just given birth, she will be milked, and her milk, instead of going to her baby, is going to go into cartons and turned into cheese and yogurt and ice cream and all kinds of other things. And she'll be artificially inseminated every year. Now, in nature, cows live to be about 20 years of age. On dairies, they're killed by about 4. And that's because their milk production slacks off a bit, and the farmers are good business people, and they understand that they would do better if they kill the mother and then put her daughter or granddaughter or whomever in her place and milk them instead. So the point is that the dairy industry, like it or not, is a meat industry. The animals are all killed, but before they're killed, they're artificially inseminated and then separated from their offspring. And this occurs 3-4 times before they're killed. So it's a cruel industry, surprisingly so. And the people who know this more than anybody are people who live near dairies. If you live near some small dairy operation, in the middle of the night, you'll hear a strange sound. And that's the sound of the mother cows who gave birth that day. And their calves were taken away from them. And this bond, this mother-infant bond, that's the strongest bond in nature, has been broken. And they're crying out day after day after day. And the people who live in these areas are just used to it. And they figure, well, that's the price of Velveeta. And many people have said, well, enough is enough. Plus their contribution to the environmental problems that we have. Cows, whether they're beef cows or dairy cows, are belching out methane, which is one of the most potent greenhouse gases that we have. And there are all kinds of other creepy things about the industry. Anyway, you get the point. To get the animals off your plate is a really good idea. Most of us weren't raised on a vegan diet. It's a new thing. It's kind of awkward. But once you discover it, it turns out to be really the best thing. And that's kind of what we're all about here at the Physicians Committee, is what I call a win-win. Getting the animals off your plate, good for you. But it's also good for the animals as well, good for the environment, good for everybody. And the work that Emily was describing, her team does a fantastic job. They meet with members of Congress, they meet with experts in the scientific world, and you discover that by getting animals out of research laboratories, the techniques that scientists start using are better, because instead of using animal DNA, they're now using human DNA or human tissues or human cells. And we're actually able to hone in on human biology in a better way. Obviously, it has to be done ethically and carefully and with the best scientific standards, but it makes science better. One other thing, Emily was talking about how it can be a little bit intimidating. I know that's true. When I've met with members of Congress or their legislative aides, the first couple of times I was a bit nervous. But I discovered something, and that is that they become your friends. The second time you meet with them, they'll say, you were here before, and we were talking about this issue, and they get back to you about their feelings about it. And as time goes on, you get to know these people, and they get to know you, and they start to be able to rely on you when they have a bill that they want to advocate. And the best news of all, at a time when Congress is very divided, you know it, there has never been a time when politics has been more divisive than it is today. In this matter, we actually don't need unanimity. What happens is, as Emily described, we're going to train you up. You get to talk to your members of Congress, the senators, or more often their aides. Then they, in turn, start to push language in the appropriations bills where they say to NIH, we're going to give you these billions of dollars, but here's what we want you to do. And that language gets in there because you have often 1 or 2 members of Congress or senators who wanted to be there. You don't need to pad around office to office to win in some of these ways. And we'll often get stern letters sent from members of Congress to NIH and other bodies too, saying, let's work together. Our constituents want a kinder, more compassionate world, and I need your help in doing that. So you discover that you really can win, even when the odds seem tough. And just in the same way as the members of Congress or their aides become your friends, often for life, that's what's happening with a lot of us. Many of the people that I'm seeing on the call now, my good friend Allison and many, many others who have been with us week after week after week, we're working together for the cause that we share. And it's such a good feeling to be working together and to have the successes that come. And so for those of you who are new to this call, maybe this is your first call, or you're new to what the Physicians Committee is about and you just wanted to check it out, welcome to the family. There's a heck of a lot of work to be done. Let's work together and we'll have lots more victories to report. We'll see you next week. Back to you, Betsy.
Yay, Dr. Barnard, so powerful. Thank you so much. I'm going to share my screen and mention one more event before we say goodbye. Well, You know what? I am going to just tell you all about this event. And another event you should have all been invited to is our PCRM 35th anniversary celebration. And it will be held on Sunday evening, December 6th. So we're going to be treated to a look back at 35 years of PCRM progress and also get a look ahead at what's to come. And we have all kinds of special guests and goodies and fun things planned for this virtual event, including Moby, who wowed us all on Mission Critical a couple of months ago. And he is going to do a special musical performance for us during this event that we are calling the Next 35. So when we send out the recording to this Mission Critical, we'll include the link. You can sign up, it's free. We want to celebrate with as many of you as we possibly can. So please register to join. PCRM.org/events. And that will give you a complete listing of all the things that are going on. And you can go through and register for Virtual Hill Day, for the classes that are coming up, and for this special event called the Next 35. So please enjoy your weekend. Happy Halloween, stay safe, and make sure to vote. So whatever the election outcome, we're sure to have plenty to discuss on next week's Mission Critical. Thank you.